Hello everyone and welcome to today's webinar where we'll be discussing AED use on children and infants. An AED can be used on children and infants and should be used as early as possible for the best chance of improving survival. Check the AED when it arrives at the scene. Pediatric pads should be used if the person is less than 8 years old. However, if they're not available, standard adult pads may be used. If using standard adult pads, do not let the pads touch each other. Additionally, some AEDs have a switch that can be set to deliver a pediatric shock. If available, turn the switch on when using on younger children than 8 years old. If the AED cannot deliver a pediatric shock, an adult shock should be given. It is important to remember an electric shock may be the cure for a fatal heart rhythm. If you are not alone with the infant, do the following. Retrieve the AED, open the case, and turn it on. Expose the victim's chest. If it's wet, dry the chest quickly, and make sure to remove any medication patches that may be on the victim's chest. Then, open the pediatric AED pads and peel off the backing. Check to make sure that the infant or child does not have a pacemaker or defibrillator on their chest. If so, just don't place the pads directly over the chest. Then apply the pads. Apply one pad on the upper right chest above the breast. For infants, apply on the upper left chest. Apply the second pad on the lower left chest below the armpit. For infants, you might need to apply the second pad to their back. Then ensure wires are attached to the AED box and move away from the person, making sure to verbalize that no one else is touching. Stop CPR and instruct others to not touch the person. Let the AED analyze the rhythm. If the AED message reads checked electrodes, then ensure the pads are making good contact with the skin. If the AED messages reads shock, then clear the victim and press and hold the flashing shock button until the shock is delivered. If it says no shock is advised, you'd go ahead and resume CPR right away, leaving on the pads. After you've delivered a shock, resume CPR for 2 minutes until the AED begins analyzing the rhythm again, and just repeat these steps until further help arrives. Don't forget we offer online BLS certification. We encourage you to become certified on your own time, whether that be with an online course or in an in-person training. Thank you again for tuning into today's webinar, and we will catch you next time.